Hello, my name is Dawn Hendricks, and I'm the Early Childhood Special Education Coordinator at the Virginia Department of Education. I'm going to be talking to you today about early childhood special education. I know that you have heard about early intervention, so I'm going to talk a little bit about what that transition could look like from early intervention. But more specifically, I'm going to be talking about what is early childhood special education and what can you expect if your child is transitioning to a school and to ECSE, as we commonly call it. So what I'm going to be talking about today is I'm going to talk just a little bit about the differences between early intervention and early childhood special education, because there are many differences. I'm going to be talking about our special education regulations and procedures, the referral, and the eligibility process for early childhood special education, and then we will finish by talking about an individualized education program. So let me go back to early intervention and talk to you a little bit about what you've already heard about early intervention. And what I want to do is differentiate between early intervention, which you probably know by now, but we call it Part C because it's the Part C of the Individuals with Disabilities Education Act, and the difference between early childhood special education, which is Part B. We call it Part B because it's Part B, the section Part B of IDEA. All right, so some of the differences. Early intervention is ran by a different state agency, is ran by the Department of Behavioral Health and Disability Services. Early childhood special education is the Department of Education. So already we have differences because there are two state agencies involved. Second difference is early intervention is implemented by 40 local systems that we call Infant and Toddler Connection, or ITC. There are 40 of them across the state. Early childhood special education is by 131 different school divisions, what the law refers to as local education agencies, or LEAs, but we informally call them school divisions. Early intervention is provided regardless of a family's ability to pay. And so there's a number of different ways that that payment can take place. I would say probably most often it's through a family's insurance, but it can also be through Medicaid, through CHIP, which is the Children's Health Insurance Program. There can be an assessment for payment, etc. With early childhood special education, it is free. It is completely free to families. And then finally, where these services take place, typically early intervention is done in the home or community by law and in the regulations. It is to be done in the natural environment. And early childhood special education, there's a continuum. There's a variety of placement options and a variety of locations where these services can be provided. But basically, services can be provided in any environment where a preschool age child may participate. So I'm going to talk about that later on. That's going to be one of the last things we talk about when we get to the IEP section of this presentation. Some of the differences here also are the ages served. With early intervention, we have children birth through age 2 inclusive. When a child turns 3 years of age, he or she is no longer age eligible for early intervention. With early childhood special education, it is ages 2 through 5. And for a child to be eligible at age 2 for ECSE, that child needs to be 2 prior to September 30th of that year. So if a child turns 2 on September 1st, that child can then enter the school year if eligible for special ed. If that child turns 2 on, let's say, December 1st, the child has not met the age eligibility for early childhood special education. A quick note here, we do have some school divisions that will accept children who turn 2 during the school year, but that is not legally required. That is their choice to do that. So with early intervention, we have a big difference in the eligibility process and the eligibility criteria between EI and early childhood special ed. So this slide is a reminder of what the criteria are for early intervention eligibility. The child can have a developmental delay, at least a 25% delay in one area. And we can see those delays or those areas on the right-hand side of the screen. That area can be speech language, motor and physical, emotional and social, cognitive, hearing, vision, and or health. The child can have atypical development, such as sensory motor, social emotional, can have atypical development with behaviors or social or language plus behavior. Or there can be a diagnosed condition, such as autism, or such as cerebral palsy, or some other sort of diagnosed condition. So that basically is a quick overview of the early intervention eligibility. But with Part B, or early childhood special education, some of the eligibility criteria are, number one, we talked about the age, if that child is age 2 by September 30th. But let's talk about this piece of it. The eligibility for special education is if that child has a disability. That's only one part of the criteria, okay? Very different from early intervention. The child has a disability. There is an adverse educational impact, and there is a need for specially designed instruction. Now, those two phrases, those two bullets are probably a little confusing at this point. So I'll talk more about that later. I will come back to this information a little bit later on, but just really to make the differentiation between early intervention and early childhood special ed, there are big differences in eligibility criteria. And so we'll piece that apart a little bit through this presentation. So early childhood special education, let's get into what this is and the referral and eligibility process and some of the other pieces. I always like to start with a definition of special education. And the law states, the regulations, IDEA, as well as our state regulations, state that a child can receive special education and related services. You will hear these terms being used together, special education and related services. So let's start with this definition of special education. Special education means specially designed instruction. There are those words again. Specially designed instruction at no cost to the parents to meet the unique needs of a child with a disability. And the rest of this description talks about where those services can be provided. That includes instruction that can be conducted in a classroom, in a home, in hospitals, and institutions, and other settings. And it also includes physical education. So that is our definition of special education. Now, related services, I think, is a little bit harder to understand. Related services is basically those services that are needed for that child to benefit from special education. I often think it's easier to give examples to understand what is meant by related services. Transportation. That child needs transportation to and from school or wherever he or she is receiving services. It includes speech language therapy. It includes occupational therapy, physical therapy. It includes audiology, psychology services. It might include family training or parent training. Again, those services that are needed in order for that child to benefit from special education services. So there's a whole myriad of services that can be under this related services umbrella. Now, there are 5 steps of this special education process. And we're going to go through these, but we're going to talk about some of these in more detail than others. So here are the 5 steps of the special education process. So this is for a child to become eligible and then develop the IEP. And then we have something called reevaluation. So let me just talk briefly about these now. First step is the identification and referral. So when a child is suspected of having a disability, then a referral is made to the school division, again, to that LEA, to that local education agency. This can be written or oral, but this is basically, I anticipate or suspect this child has a disability, and I would like this child to be evaluated for special education. That is the referral. Evaluation, the school evaluates the child to determine whether the child has a disability. And again, those words, if the child has an adverse educational impact, is this impacting that child's education and that child's ability to learn? Once the evaluation is completed, there's a determination of eligibility. So, based on the results of the evaluation, a team decides if the child is eligible to receive special education and related services. If so, the next step takes place, which is the development of an IEP, or what is called an individualized education program. This is to determine if that child, I'm sorry, this is the services and supports and goals that this child will be working on throughout their year, basically, their first year, and then second year, et cetera, of special education. And then finally, our last step of this process is the reevaluation. At least every 3 years, a team must reevaluate the child to determine, do they still meet criteria for special ed and related services? Do they still need special education? So let's go through some of these in a little more detail. So we're going to start with the identification and referral and the eligibility process. That's what we're going to talk about in the next few slides. So identification and referral. A referral can be made by anyone. It can come in from any source. A common referral source is the parent or guardian. So you might suspect your child has a disability. Perhaps they're not meeting speech language milestones. Perhaps there's some sort of behavior. Maybe your pediatrician has diagnosed your child with some sort of a disability. So a parent or guardian can make that referral. As we talk about early intervention will be making a large number of referrals. They refer many children on to early childhood special ed. A teacher can make that referral, a doctor, a grandparent, and sometimes these referrals come in from school screenings. So there are required screenings that when a child is in school that they receive. So for example, a required screening is every child has to receive a vision screening. Every child has to receive a speech language screening. There are requirements in our code of Virginia and our regulations. And so through that screening process, it is designed to identify children who might indeed have some sort of delay or disability and might need special ed and related services. So that's a common way for referrals to take place. A referral may be made in writing, in person, or by phone. So when a referral is made, so let's say you are a parent and you suspect your child has a disability or might need some sort of special education services, you're going to contact your local school division. So if you live in Chesapeake, you'll contact the school division for Chesapeake. If you live in Chesterfield, you'll contact Chesterfield. If you live out in the Southwest and you're in Bedford County, you will contact Bedford County Public Schools. Another good way to do this is, where's the nearest physical school to your house? Perhaps around the corner is Matoaka Elementary School. I'm just making that up. But you can walk into that school and do that referral. You can also call the Virginia Department of Education, and we are happy to help you find the contact information to make those referrals. If you are receiving or your child is receiving early intervention, they will make the referral for you. All right, so again, a referral can be made in writing, in person, or by phone. And when a referral is made, there is a designee, there's an administrator in the school division who receives that referral. And there are 3 things that designee or that administrator might do. The first one, I'm going to go in reverse order from what I have written here on the slide. The first one is they can deny the evaluation. That is unusual. That is unusual, but it might happen. So if there's not enough evidence to support that this child does indeed have a disability, does indeed need special ed, that designee, that administrator might deny the evaluation. So I'll give you an example of this. Again, it's unusual for this to happen, but perhaps a parent calls and says, my 3-year-old is not doing the exact same things as my sister's 3-year-old. That doesn't necessarily mean there's a disability. So that designee might ask more questions. What has been done to evaluate the child? What are some of your concerns? Those sorts of things will take place to determine, should this indeed be denied? Or should we move on to one of the other 2 steps? Most likely that designee is going to do one of these other 2 steps anyway. One of them is, if there's enough information, move that child on to evaluation. Second option is to move the referral onto what is called a school-based team or a referral review team, who then looks at the data, who looks at the concerns, and determines should this child be evaluated. This is most likely the step that will take place. The designee will look at the referral, move it on to a school-based team, or the school might call it a child study team or a referral review team. There's a lot of different names for this in our school divisions. And they will look at the evidence. If the child is moving from early intervention, we'll look at the evidence from early intervention and will then determine, is there enough information to move this child on to be evaluated? All right. So in the event this child is moved on for an evaluation, what does that mean? It means that a team, including the parents, so yes, you as parents are very important team members here. Remember that. Always remember that. We'll look at the existing data and learn about the concerns about the child. So you as parents will discuss your concerns. If you have grandparents that know about the concerns, if you have a child care provider that maybe brought up concerns, all of these individuals will bring forward concerns. We'll discuss those, any evidence that exists. So for example, a child moving from early intervention, there might be the IFSP, the evaluations that have been completed. Perhaps there's medical records from a pediatrician or a diagnostician. All of that information will be reviewed. That same team of individuals will then look at any additional data that might be needed and will develop a plan to get that information. So this is the evaluation. We have an IFSP. We have the evaluations from early intervention. There's a medical diagnosis from a pediatrician. What other information do we need to determine eligibility? They will determine a plan. And these other pieces of data can include observations at home, observations in the community, observations in a classroom if that child is in childcare or preschool. It can include completion of standardized assessments, and it can include interviews of parents, of teachers, and others who know about the child's development. So all of that information will be identified. What do we need to do? A plan will be developed for getting this done. And then the team will reconvene to review the data that's gathered and determine if the child is eligible for special ed and related services. So through this entire process, from the day that referral is received from the designee to the day that the eligibility is determined, that takes 65 business days. Legally, the team has 65 business days to complete that process. It's really important to remember. This is a process. It takes some time, and that is the legal mandate, 65 days. All right, so let's look at these disability categories. So we have certain disability categories that are recognized under the Individuals with Disabilities Education Act. So let's look at these. Autism, developmental delay, deaf-blindness, emotional disability, hearing impairment, intellectual disability, multiple disabilities, orthopedic disabilities, other health impairment, specific learning disability, speech or language impairment, traumatic brain disorder, and visual impairment. These are the 13 disability categories that are recognized and under which a child may be found eligible. Each of these will have their own definition and their own criteria. So for a child to be found eligible under the category of autism, there's going to be specifics related to social and behavior, right? The major criteria for autism. For a child to be found eligible under traumatic brain disorder, there has to be specific evidence of that brain disorder that occurred. Visual impairment, same thing, right? Like those criteria are going to be very different, and every school division is going to have a set of criteria that the child is to meet to be found eligible under these. Now, I do want to point out specifically developmental delay is an eligibility criteria we use for children from age 2 up through age 6 inclusive. And so developmental delay is an area that we look at the percentage of delay. of a child. And so that can be in a number of different areas, such as motor, cognition, speech language, etc. And so this is an area that's a little broader than some of these other, but there will also be a very specific set of criteria for a child to meet to be found eligible under developmental delay. Okay, so let's talk a little bit about the evaluation. So a child must be tested by qualified personnel. So most likely there will be a school psychologist as well as educators. There definitely will be educators involved in the evaluation process. So there could be a general educator as well as a special educator. And the different areas of evaluation might include health, vision and hearing. A hearing screening must be completed. It is required as part of our eligibility process. The team may look at social and emotional status, general intelligence, academic performance, and you might be saying, Dawn, these are very young children. What do you mean by academic performance? We look at those pre-academic skills and we look at those functional skills that are germane and relevant to preschool age children. So we're not looking at, does the child know his ABCs? We're looking at what are those functional skills that would be expected of a 2-year-old child, of a 3-year-old child, of a 4-year-old child. We look at motor abilities, adaptive behavior, such as self-help skills, navigation, independence, and then communication. The eligibility team is a very important part for parents to understand. An eligibility team is going to include teachers. So again, a general education teacher and a special ed teacher. It will include an administrator. It will include a specialist who has knowledge and ability to interpret test results. So again, that's most likely going to be a school psychologist, or it might be someone else on the team who can fill that role. Part C may be invited if you would like, as a parent, would like to have your Part C representative there. That's up to you. But most importantly, parents. Parents are a core part of this team, and you're going to have the most information about your child. So being a part of this team and bringing that information forward and being a part of the eligibility determination is going to be a critical role for you to fulfill. All right, so there's a lot on this slide for us to talk about, and some of it I've already talked about. But I'm going to stress again how important you are to determining the eligibility of your child for special education. I once again am providing the reminder of what the criteria are for eligibility determination. It is not just the presence of a disability. That disability has to have an adverse educational impact, and there needs to be a need for specially designed instruction. So here's our definition for specially designed instruction. This is how the law, how IDEA writes eligibility criteria. It is about adapting the content, the methodology, or the delivery of instruction for the child. It is not about more instruction. It is not about Joey needs more instruction in order to learn social skills or how to identify letters of the alphabet or how to play appropriately or how to navigate his environment. It's about needing an adaptation in the content, in the methodology, or the delivery of instruction. So specially designed instruction is designed to address the unique needs of the child that result from the disability and to ensure that that child is able to access the general curriculum so that he can learn and meet educational goals that apply to all children. So let me give a couple of examples on this slide. For adverse educational impact, because a child has a disability does not mean there's going to be an adverse educational impact. If a child uses a walker to walk, for example, perhaps he or she has an orthopedic impairment. Maybe the child has cerebral palsy. Doesn't necessarily mean that child is impacted educationally. Doesn't necessarily mean that that child needs specially designed instruction, needs the content of the preschool curriculum adapted in some way, needs different methods for learning. This child can learn fine. It's just the child needs a walker in order to navigate around his or her environment. So there's an example of a child who might have a disability, but there's not an adverse educational impact and doesn't need specially designed instruction. Let me give an example of a child who does need specially designed instruction. We have a child who has autism, and that child needs adaptation of the content. So instead of in the curriculum, perhaps there are 5 words that are introduced related to a community helper, like a fireman. Instead, that child is learning 2 of those words. Methodology. We're going to provide instruction using prompting and reinforcement. Delivery of instruction. We are going to deliver that instruction in more of an intensive way. So we're going to have a small, specific group of children that are getting instruction related to specializing what is needed for that child to learn. So 2 examples, one child who may not qualify, one child who does and needs specially designed instruction. All right, so the evaluation and eligibility process, we've already talked about this. What I do like to stress here is the team has 65 business days to complete the eligibility process, so remembering that. So as that reminder then, if that child is found eligible, then what is going to happen is that child is going to get an individualized education program or an IEP. So an IEP is made up, the IEP development has the same team members largely as what we found in that eligibility team, made up mostly of the same team members, an educator who's a general educator, an educator who's a special educator, administrator, parents being a core part of that team. Again, you know your child better than anyone, so making sure you're bringing information forward about your child and your goals and your dreams for your child. And what that can then turn into is putting goals into the IEP and what we want to develop for that child and what we want that child to be working on through the course of the school year. Part C may be invited to the IEP meeting as well with parent permission. This is your option. You let your IEP team know if you would like Part C to be invited. And then there's 30 calendar days for an IEP to be developed. Again, remembering on the previous slide, we had 65 business day to determine eligibility. With an IEP, it's 30 calendar days. So this goes much faster. So once that child, if he or she is found eligible, then 30 calendar days to write the IEP. The purpose of the IEP is to document the child's unique needs. And in this, we're going to have a present level of academic achievement and functional performance, also known as a present level of performance, just kind of shorthand there. But this is going to describe the skills and abilities of that child. We are going to have measurable annual goals. What is that child going to be working on during the course of that year? We're going to write out any accommodations or modifications that child might need. So for example, maybe that child needs preferential seating during any sort of whole group activities. Maybe that child needs to be near the front of the line whenever you're transitioning throughout the school, those sorts of things. Special education services and related services. What sort of services is this child going to be receiving? Educational services, most likely. Speech language might be in there. OT, PT. Those are the sorts of things that we're putting here. And then the placement. Where is this child going to be placed? Where is that child going to be receiving their educational services and related services? The IEP team will meet at least once a year to review and revise the child's IEP. So anytime I present on special education, I always provide this reminder. And maybe this is the first time you're hearing this, but special education is a service, not a place. It's easy for us to think about special education. Most of us have heard these terms. We know a little bit about it. Maybe we know a friend or a family member whose child is receiving special education services. Maybe we remember back to our own school services and remember special education or classrooms that were designated as special ed. It is a service, not a place. Yes, there are classrooms designated as special education, but I want you to remember that as a parent. Special ed is a service, not a place. So it's about what sort of services is that child receiving After we identify the services that child needs, then we identify where, the placement. Where is that child going to be receiving those services? So what I want to do now is skip here because this is going to tell us where might a child be receiving those services. A child can receive special education services in what's called a regular early childhood program. For example, we have a state-funded preschool program called the Virginia Preschool Initiative. We also have a federally funded preschool program called Head Start. And then there are many community-based preschool programs. So maybe Miss McGillicuddy's preschool program is down the road from you, or maybe your child attends ABC Childcare. These are examples of regular early childhood programs. These are programs where children, both with and without disabilities, go. Children can receive their services in a separate classroom. Now, that's often what we think about when we think about special ed. That's that self-contained, separate special education classroom. They can receive services in a separate school, a residential program. Our children can receive services in the home, and there's a variety of reasons for this. So if your child is in early intervention, services are likely being received in the home now. But that can also continue into early childhood special education if that's where the IEP team determines is the appropriate placement for that child. So again, you as a parent have a say-so in this. You can say, I really like this early intervention model and I want my child to receive services in the home. Or you could, perhaps you have a child who's medically fragile and that might be the best environment for that child. And then finally, our last setting is a service provider location. For example, a speech therapist's office. So maybe this child only comes in for speech therapy and that's delivered in that speech therapist's office. That's what's called a service provider location. So these are our educational environments. Again, remembering that special education is a service, not a place, and those services such as educational services, speech language, occupational therapy, physical therapy, all of these services can be delivered in any of these settings. A regular early childhood program, also known as general education in the K through 12 arena, a separate classroom, separate school or residential program in the home, or a service provider location. Now, before I move the slide, one of the things that I do want to mention is a very important concept in our regulations, and that's the concept of least restrictive environment. This is the notion that children with disabilities are to be educated with children without disabilities to the maximum extent possible. So when we're looking at placement for our children with disabilities, we want to be looking at the least restrictive environment first. And that is going to be that regular early childhood program. So keep that in mind as you're working with your IEP team. Now, to go back to the slides that I did skip past, I do want to quickly mention that our final part of the special education process is reevaluation. Remembering that every 3 years, a child is to be reevaluated to determine if that child is still eligible for special education services. This is called a triennial. The child can be reevaluated more often if the parent or the teacher requests that to happen. Maybe something has happened that the belief between the parent and the teacher, the data is showing that this child may not still need special education services. That's what we want. And so you can do these evaluations more often if you would like to. The reevaluation is just like the initial evaluation. Same team members. The team is going to look at the data that exists, but by the time we have gotten to 3 years down the road, we have a lot more data to look at. And we are going to then identify what other data is needed, go out, gather that data, just like we did before through that evaluation process, and come back to look at eligibility once again. So again, this is done every 3 years. All right, so as I wrap up here, I do want to make a note about parents and family because the parents and family are such a core component of early childhood special education. And what I have here on this slide is looking at parental involvement as well as parental rights, because both of these are core components in our early childhood special education programs. So looking first at parental rights, but there are many legal rights and protections that parents of children with disabilities have that are written into IDEA and are written into our state regulations. They basically give the rights to parents. You must provide permission or written consent for these steps to happen. A school division cannot do these on their own. You must provide permission or written consent for that evaluation to be completed. You must provide written consent for that IEP to be implemented. And then you are given the opportunity to participate in meetings concerning your child's special education. This is just a brief overview of your parental rights. My very last slide provides a list of resources that address this and that you can go to for more parental rights as well. But just really wanting you to be aware that you have many rights as you go through the special education process and as your child may receive special education services. And then finally, parental involvement. I'm not sure that anything could be much more important than talking about our parental involvement in the special education process and also in the implementation of special education. That education of children with disabilities can be strengthened by having the parents be involved, be intimately involved in the education of their child, and that you have meaningful opportunities to participate in the education of your child, both in the school and also in the home. So keep that in mind as well. Many of our school divisions, if not all, have a very robust parent involvement strategy. And so looking really at parent engagement. So make sure that you take advantage of that and be as involved as you possibly can be in your child's education. Okay. And so that concludes it for me. Again, my name is Dawn Hendricks. This is my email here. I'll pause for just a second before I move on to the next slide so that you can jot that down if you would like to. And then as I move on to the next slide, these are a number of resources that we have. If you go to our Virginia Department of Education website, we have a lot of resources very specific to families, so be sure to check that out. All right, thank you so much for being here today and for participating in this webinar.